This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
So aspects of wound care to try and prevent wound infections. So, a while ago, there were a bunch of studies that actually looked at the kind of irrigation solution that's used. And the studies compared things like normal saline and other sterile, pricey solutions to tap water on rates of wound infection. There were multiple studies that looked at this, and several large reviews showed interestingly that tap water was just as effective. There was no increase in risk of wound infection. So if somebody can get to the sink and stand there and the body part's amenable to it, it's very reasonable to just have them run that body part under running tap water for a little bit of time to get it cleaned out, and that's very reasonable. Another kind of group of studies that have looked at the need for sterile gloves and whether sterile gloves have a difference. So there was one study back in 2004. That was the last time they had looked at this. And that study showed no difference in wound infection. And then there was another recent study that kind of the reason I brought this up, that again, it was a well-done study. It was done in, I think, the Netherlands at 3 different emergency departments. And they randomized about 1,500 patients to wound repair with either sterile gloves or non-sterile gloves. And they looked at wound infection rates. And again, it showed that there was really no benefit to preventing wound infection by using sterile gloves. Actually, the rates were a tiny bit lower with the non-sterile gloves. So if you think about the amount of kind of packaging and cost with every time we need to use sterile gloves, there's probably no benefit to it. It's a lot simpler to use non-sterile gloves. So if you see somebody suturing a wound with non-sterile gloves, don't think that they're crazy. If you want to irrigate with tap water, you can tell patients it's been shown to be just as effective. And people have probably heard the saying that the solution to pollution is dilution. So kind of the most important thing when we're cleaning out wounds, especially if they're dirty, is lots and lots of irrigation. And it doesn't matter what we use for it, but just irrigating the wounds, kind of getting them clean with lots and lots of irrigation is probably the most important thing, more so than kind of sterile techniques or fancy drapes, fancy gloves. All right, thanks guys. Have a good night.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.